experiences. And we'll mention Tate Gilchrist as well, who was unable to join. But Kate Dixon is in her second year of medical school here at KUMC with an interest in primary care and public health. She currently works as a volunteer manager at the Unified Government Public Health Department, where she assists with various public and community health efforts, including the contact tracing investigation team alongside Sami and Tate. Sami Rios is a fourth-year medical student at KUMC with hopes of matching into an OB/GYN residency this year. Prior to medical school, she worked at a college career mentor for high school students in Wyandotte County. She then discovered her passion for women's health in underserved communities after serving as a director for the JDOC Women's Health Initiative project. She's thankful for the opportunity to be part of the contact tracing leadership team and assist the Wyandotte County Health Department. Tate Gilchrist is in her fourth year of medical school here at KUMC as well, with hopes to go on to an anesthesiology residency next year. During her first few years in medical school, she was on the executive board for the JDOC Free Clinic, which is where her interest in public health and addressing health inequities began. She's now one of the contact tracing team leads, helping the Wyandotte County Health Department during the pandemic. So welcome, girls. Thank you so much.
Yeah, thank you so much for having us. We have a short slide deck we're going to share with you. Alexa, do you mind sharing that still?
Not a problem.
Thank you so much.
Sure.
So we are talking about contact tracing today, specifically at the Unified Government Public Health Department here in Wyandotte County. If you'll click next. So what is contact tracing? So for every positive COVID-19 case that resides in Wyandotte County, our team calls them, assesses their symptoms, their potential exposures, anyone they themselves may have exposed during their infectious period, and any social needs they may have during their course of illness, such as food, cleaning supplies. Maybe they need to be connected with a community health worker for various reasons, or with other federal assistance. We've been able to connect with U.S. Representative Sharice David's office, who helps with some of those higher level federal assistance needs. Now I'm gonna let Sami, the other contact tracing team lead, get into the more specifics of what that looks like for a volunteer. Sami, if you wanna take it away.
Yeah, hi everybody. Thanks for tuning in. I'm super excited to talk to you about this. It's been a ton of fun being on the team. So basically, just quickly, kind of how I got into it. And Kate, we kind of just fell into this position as third years, second years. We kind of wanted to help with COVID, but we weren't really sure how. I was working the hotline at one point down at the family clinic, and but you kind of only get one side of it when you're just working the hotline. You don't get to really follow up and actually talk to people and see how people are doing. So this was a really good opportunity to actually connect with people. So what our job is we get a positive case that comes to the health department and we get it assigned to us. Now, theoretically, they've already been told they're positive. So we don't have that job of telling them they're positive, but our job is to call them, and ask how they're doing, ask about their symptoms, when their symptoms started, what kind of symptoms they were having. And we have this awesome, it's a work in progress database called EpiTracks that we actually enter all our information into. So that all this information is getting collected. Now, we're asking about symptoms, we're asking about medical history, we're asking about if they've been hospitalized, how long they've been hospitalized. So really getting a ton of information about the case themselves. And then we kind of shift it over into how did you get infected? Where may have you gotten infected? And some people will have this amazing timeline of exactly where they've been for the past 2 weeks. And some people are like, I have no idea. I haven't been around anybody, maybe the grocery store. Mm-hmm. So we kind of get that story. And then we figure out who they may have passed it on to. And a lot of times this is work, this is, your family, who you're living with. And we have to kind of dig a little bit. And one of our big jobs is to get that information about the contacts and then actually call those contacts and let them know, hey, you've been in contact with somebody. We need you to quarantine. So we have to be very familiar with the guidelines, and this is part of what goes into the training, which isn't bad at all. And then we give that quarantine guideline advice. We also provide letters to employers. We contact employers to let them know, there may have been an exposure in the workplace. We ask people about their social needs. So like Kate said, some people really need that. Their whole house is quarantining. So we really need that food delivery service because no one can leave their house to go get food, or maybe it's cleaning supplies, or maybe it's masks. So we have actually a service that will literally deliver it to their house, we are super thankful for the service. And then we also recently have been connecting people with the community health workers. So this would tackle items like transportation or employment or any of the other needs that are not being met. And we have some great community health workers that are bilingual and really touch all those needs of the community. So it's been a really, really cool experience for me. One, people are really bored when they're in quarantine. So you get a lot of people that just want to chat, and you get some pretty awesome stories. And you can tell that most people are pretty thankful that they're having somebody that can answer a question that they might not have been able to answer, or other people haven't been able to answer. Just real quickly, I wanted to share a cool story. I guess it's not cool for the guy, but I had one man that I called, and he sounded really sick on the phone. He was having a hard time breathing. He couldn't speak to me in full sentences. And so I kind of started getting worried. And I told him, I was like, listen, sir, I think you need to go to the hospital. Well, I followed up with him. It turns out he did go to the hospital. He was in the ICU for a week and ended up being fine. But it's just those moments that you're like, okay, who else would have caught that? Or who else would have told this poor guy to go to the hospital? So those are just some meaningful moments that have happened with contact tracing.
Thank you so much, Sami. You can go ahead and click next. So kind of why we're here today is, to introduce what contact tracing is. Sami did such a good job. And then also kind of talk about the numbers and where we're at in terms of needs. So this was as of yesterday afternoon. I pulled this from the Wyandotte County dashboard. And this is specifically for our county where, we are going to school, where we work, some of us live. There are 3,749 confirmed cases here. On a recent analysis that I was working on, we found that all of our cases average about 2.26 contacts per case. So that means there are 8,472 contacts that our team is in charge of getting a hold of. Now, that's of course from the beginning of the pandemic. So the workload's been spread, but we definitely are in need of more bandwidth and more humans to help out. Go ahead and click next. So what does this have to do with global health? What does it have to do with the international programs which we're presenting for today? You can click next. I'm sure you all have heard COVID-19 is a pandemic. Heard the rumors on the street. And this is WHO's definition of a pandemic, an epidemic occurring worldwide over a very wide area, crossing international boundaries and usually affecting a large number of people. So while we are focused on helping folks within Wyandotte County, this has worldwide impacts, right? We've all seen it, and getting involved where we can, I think, is incredibly important. Go ahead and click next. Additionally, I think that what draws a lot of students to international programs is the ability to get some cultural enrichment, right? Like we want to experience things outside of Kansas. We want to expose ourselves to new cultures, new worlds. And I didn't know this, and Sami, maybe you did being a little bit further along in your medical career, but I didn't have any idea of the diversity that was in Wyandotte County until I started contact tracing. And doing a little bit further research, I found that Wyandotte County is ranked second on a lot of ranking list as being the most diverse county in the country, the second most diverse county in the country, which is just incredible. I believe there's only one county outside of Fort Lauderdale, Florida, that has us beat in terms of demographics, which I think is a wonderful opportunity, right, to get involved and to expose yourself to other cultures that are right down the street. You can go ahead and click next. And this is a breakdown of the demographics based off the census data that we pulled that just shows that whites only take up 40% of Wyandotte County. We have a beautiful array of cultures and different populations, including refugee populations in Wyandotte County, that you would have the opportunity to connect with and, you know, have very, very intimate personal conversations with regarding their course of illness and other needs that they have throughout their course of illness. You can click next. These are just a few of our main languages that our contact tracing investigators get to experience during their investigations. We use a service called Propio. I'm sure many of you are aware of that service that's used across KUMC to communicate with folks that speak these languages. Many of them I didn't even know existed until this summer. Hakachin was very new to me, Karen, Karini. So it's been really wonderful to develop those skills of using an interpreter and also expanding my knowledge of these different groups that have moved to Kansas City and are living their lives right down the road from me, which I think is super wonderful. You can go ahead and click next. So before we get into more discussion, conversation, we wanted to make sure that those that are interested in getting involved have the right information. So Sami, Tate, and I are responsible for onboarding KUMC volunteers that are interested in getting involved. If you just send us an email, we'll send you the onboarding handbook and get you started on that process. In terms of commitment, it takes on average an hour and a half for one case. A lot of our students, especially with the new school year starting, or like Sami's colleagues being in clinicals, will only take one case per day. We have a Google spreadsheet where you're able to build your own schedule. If there's a particular week that you can't take cases, then you just notate no cases in that week on the Google sheet and you won't be assigned any. And again, you can limit the number of cases you take per day. Yeah, I think that hits it. Sami, do you have anything to add?
So just in terms of volunteers, you know, even if we had 100 people taking one case a day, that can make such a huge impact on our caseload, because at this point we're getting at least 70 cases a day, and we probably have about 20 to 25 contact tracers. So we're really, really in need right now. And we will take anyone who's willing to even do a case a day, a case a week, anything is helpful.
And it really is a wonderful experience. I think, you know, like Sami talked about earlier, getting involved in some sort of COVID-19 effort was super important to us. And I think a lot of us that are going into or are already in the health profession field, this is a really opportune time to get involved in something that's super meaningful, super impactful, and also there's a lot of benefit, especially to you know, health profession students as we're developing our own clinical skills. While it's not in clinic, it's not face-to-face, you're learning how to communicate complex COVID-related information to a very broad array of health efficacy, and just getting to really build, albeit over the phone, relationships with folks is super important and great opportunity to build those skills. So that's all I've got.
Kate, Kate, I have a few questions kind of related to someone volunteering. From your perspective, because I'm just thinking of who we can tap into to help support your efforts. So from your perspective, does it need to be someone who's specifically in, the health field, or a student who's studying? Or because I'm thinking of like our administrators group, and there's so many support and administrators who might have time, maybe even in the evenings, to support your efforts. So can you speak to that a little bit?
That's a great question. I think it is important to have somewhat of, even bachelor's level health background to kind of understand how to explain infectious period and why we're doing these quarantine and isolation periods the length that we are. I think that is definitely helpful. However, our handbooks, and we have a 4:00 meeting every single day. We've got a group me. We have our cell phone numbers. There's all sorts of ways to ask questions. So, I mean, we're willing to take people that feel confident in their ability to communicate health related information to folks, and really who are able to navigate different softwares. I think that's honestly as big of an issue in terms of the onboarding process as the protocols, right? Because we have EpiTracks that we're using, we have an office form that we use for social determinants of health, and we have another system called Sarah Alert that does text backs for our contacts. So it's really the software part of things and the documentation, which is nothing new to healthcare field, because that seems to be always a burden anywhere you look. But it's having confidence and the knowledge to navigate those systems as well.
Okay, well, I won't sign up, but no, I mean, you guys, it's amazing to me as students that you have found the time. Obviously, you have the enthusiasm and the dedication, but that you've found the time to help support this effort. Can you speak to that a little bit from the students' perspective, and where they might have some concerns about, balancing their education versus volunteering for something like this?
You too.
So we always tell people when they onboard, school comes first. We're big advocates for that. But I will say, during your first years, and as we're doing more virtual learning, where you can kind of watch your lectures online, it gives you more time in the middle of the day, or even if you have a quick hour over your lunch break. I make my calls during my lunch break personally. I mean, not everybody will want to do that, which I understand. Or even just one call in the evening. And as you get better at it, you get faster. And honestly, my calls probably take 30 minutes now. So, and it also depends if you're speaking with somebody who's bilingual versus, or not bilingual, who speaks another language versus an English speaker. That's going to make a difference. But even on the weekends, if you're not doing anything, I would rather have somebody volunteer just for the weekends than not have them volunteer at all, because they're afraid they won't have time. But it is a balancing act, and I think that's going to be something that you're always going to have to balance no matter what through your career. So might as well start practicing now with COVID.
That's really well stated. I appreciate that, Sami. Being able to organize and manage your time is a big skill that has to be developed no matter what your job is. What about other questions? Dr. Mabachi, Dr. Hondrick?
Hi, everyone. I'm Tanya Hondrick. I'm director of the KU Master of Public Health program on our Kansas City campus. And I just want to say kudos, good job. Thank you so much for all your hard work in the community. This is really important experience for you all to have real world experience. And our MPH students have been doing contact tracing for their MPH internship through KDHE this summer. And I've just been in contact with Wyandotte County this week about getting a few of our students over there for the fall semester. So I hope you all get to connect and learn from each other. If there's anything that we as the MPH program can do to help, please reach out at any time. And just keep up the good work. And if you would like to talk about getting an MPH while you're getting your MD degree, you know, that's my job. My day job is to promote the MPH program. So I'm happy to talk about that too, or send your friends. So thanks again. Thanks for letting me join today.
Thank you so much. Yeah, that's exciting to hear your students getting involved at KDHE. Now we do our systems a little bit different at Wyandotte, so we haven't quite had the need to tap into KDHE yet. But yeah, if you guys have more students that are looking to get involved in Wyandotte, definitely let us know. We'd love to have them on the team.
Hey, Katie, I just wanted to say again how awesome a job you guys are doing. I have a bit of insight into some of the stuff that you're doing. And one of the aspects of your job of not just contact tracing is the social part, the social determinants part of what you're doing, which I think is so important. And I was hoping maybe you can just go a little bit more in depth into some of the needs that have really specifically come up and the organizations that you're partnering with to address those needs, so that folks can hear how you guys are looking at this, not just, you know, blink at one issue, but looking at it more holistically, which, as we know, is so important during this time.
Yeah, thank you for bringing that up. That's kind of been why it's been tough to link up with KDHE, is because our services, our investigations have become so much more than COVID-19. It's really given us an opportunity to build trust with community members and allow them to open up to us regarding some of their other social needs. So we first just started with food. The UG, the Unified Government Public Health Department, was already partnered with Crosslines, which is in Kansas City, Kansas, and they do, they originally were a food pantry, but they expanded that to do food delivery services with folks, you know, being at home for shelter in place, or then, you know, being sick, being immunocompromised. And that was doing so well that we partnered with them for our investigations. So they were able to deliver to positives so that they didn't have to get out of their isolation in order to get food. We then expanded that to be cleaning supplies. We noticed a lot of people were asking, you know, for mask or for bleach, something so that they could keep their area clean from their family members while they were isolating from them, you know, which seems so, it seemed like I wouldn't have even thought about it. You know, we have cleaning supplies underneath the sink, and if I need to wipe things up after me, it's those things that I think, for me, I've personally taken for granted, and it's made me so much more appreciative of those tiny things. But we collaborated with We Can KC for the household cleaning supplies. And originally they were delivering separately, but we've combined them so that we can streamline efforts, so that where before people were requesting food and cleaning supplies independently, they now will get both. Whether or not they request food or cleaning supplies, they will get a box of food and a box of cleaning supplies to anybody who expressed interest in either, which we were really excited about. We then expanded again to include, to ask about difficulties in maintaining employment, stable housing, transportation, and healthcare. So if they express need for any of those things, we automatically connect them with our community health worker team. Guadalupe Treadway is the just absolute gold standard community health worker. I can't say enough positive things about her. And she is bilingual, so she really has been wonderful in our Latinx community, building trust amongst Wyandotte County Latinx populations. There's been, it's been especially hard with different things going on at the federal administration level, obtaining information that's important for us to do our job, but there being a distrust in releasing that information. So Guadalupe has not only been able to help bridge the gap for other services like healthcare, transportation, et cetera, but also for us to really have a finger on the pulse in the Latinx community in Wyandotte County so that we can continue to be helpful to them. And the federal assistance piece, luckily we haven't had to refer very many of them to the caseworkers within Representative Sharice David's office, but it is really wonderful to have that available to offer. We're hoping to expand on it to ask about loneliness factors, really get into mental health questions, and then provide people with necessary services for, you know, maybe it's just a buddy program that we're able to get off the ground to where, you know, Sami talked about it earlier. Some people just want someone to talk to, and to provide that service. We're really hopeful that we can provide that in the future, but it really does show you how much leverage, I say leverage for lack of a better term, but these calls are really they're probing questions, right? And people are scared. COVID-19 is really scary. And to be able to give something back to your cases in the form of social services or just a listening ear, I think is far more important than the data that we pull from the phone call. And so being able to build those relationships and have those services in place so that our investigators are able to give and not just take has been widely pivotal in and super embedded in all of our processes and our onboarding process. And that's why it's kind of complicated and we have 3 different programs going on, is because we don't just want to be the contact tracing team. We want to be much more than that and provide, you know, the wraparound services like Dr. Mabachi was talking about. So Sami, Tate, and I, and in partnership with the UG, have worked really hard on that. And while we've been able to crank out a lot of cases, I think that's what I'm most proud of, is that we really are able to build relationships with these folks and give them things that I otherwise would have never thought about. So it's been good.
That's really incredible. I'm so glad. Thank you, Dr. Mabachi, for bringing that point up and mentioning that, because that just really kind of shows that it's so global, their approaches and providing resources. And I think that just really shows how you're able to establish trust with the people that you're calling, you know, and that's incredible. Like you said, to be more than just someone who's asking questions, but you have information to share, resources to share. I know we're running a little bit out of time, but I think that also kind of connects to what you were saying about the cross-cultural and diversity component. And I think right now this is really important to our student population because we can't travel internationally right now, right? So that global health, global is local, local is global kind of idea. Could you both just speak again to that maybe a little bit, and how, you know, and how important that is, or that aspect that you've gotten out of your contact tracing?
Kate, I can start on this one. So like she said, we speak with a lot of people of completely different backgrounds. I'm learning a ton. I know there was a big outbreak in one of the meatpacking industries, and a lot of Burmese folks were from there. And you just learn a lot about their culture, how, you know, how they live. There's like, some people have like 20 people in their household, and that's just the culture. You live with your grandparents, you live with your sister's kids. And so it's learning about that. And it's also learning these people are really scared. They don't speak the same language. They're afraid they're going to lose their job. And so you are the gateway between them and sometimes their employer, which to me was crazy to even think you would, like, how do you employ all these Burmese people and not have a Burmese speaking somebody? But we are that bridge for them. And so I feel like I've learned a ton about the Burmese culture, but also I'm Hispanic, but I still feel like I'm learning a ton about the Spanish culture. And I mean, Wyandotte County does have a lot of undocumented people, and you can sense the nervousness on the phone, and just to give some ease to that, and give them resources, and let them know that they can be connected with the health center, and it's not to get you, it's to help you. That is, and just learning how to, a skill that I think we all need to learn is just how to talk to people and how to make people feel comfortable, and no matter what culture they are. But especially when you're speaking of different cultures, just learning how to relate and finding things that you relate to them and they can relate to you. And that's how you connect, really, at the end of the day.
I love that you say that, because I always say really about being human, it's about connecting. And so I really appreciate that, Sami. That really spoke to my heart.
Kate, anything?
Yeah, I think you summed it up perfectly. I think finding ways to connect with individuals is especially difficult over the phone, but it's building those skills so that when we are in the clinical setting, when we are in research setting, when we're out there in public health field, we've already developed those skills. Yeah, it's been really great to have a glimpse into the different lives that are lived in Wyandotte County that are, in the same county as the school. I think that we can kind of get caught in our little bubble on campus. And this has been a really wonderful way to get outside that bubble and see what else is going on.
Do we have any more questions or comments for our presenters before we stop the recording? Okay, Alexa, you want to stop the recording?